Does dental implant procedure hurt? The truth about pain, recovery, and reality. The number one reason people avoid dental implants isn't the cost. It isn't the time. It is the fear of pain. You have probably seen the animations of screws being driven into bone and felt a shiver down your spine. But what if I told you that the majority of patients report feeling less discomfort during an implant procedure than they do during a routine tooth extraction? Today, we're stripping away the myths and giving you the raw, clinical truth. We're going step by step through the surgery, explaining exactly what you will feel, when it might actually hurt, and how modern technology has turned one of the most feared surgeries into a predictable, painless reality. If you have been delaying your smile transformation because of dental anxiety, this video is for you. To understand why dental implant surgery is surprisingly comfortable, we have to look at the biology of the human mouth. The most intimidating part of the procedure is the idea of a titanium post being placed into the jawbone. However, here's a medical fact that surprises most patients. Your jawbone does not have pain-receptive nerve endings. Unlike the pulp of a tooth, which can scream with sensitivity, the bone itself is relatively quiet. The discomfort associated with dentistry usually comes from the nerves in your gum tissue and the ligaments around your teeth. During the dental implant procedure, your oral surgeon or periodontist uses highly effective local anesthesia to completely numb these areas. By the time the surgery begins, the surgical site is in a state of total, profound anesthesia. You will feel pressure, the sensation of the dentist working, but you will not feel sharp pain. For those with extreme dental phobia, options like IV sedation or sleep dentistry are available, ensuring you have no memory of the procedure at all. Step 1. The preparation and local anesthesia. The process begins with the administration of a local anesthetic, such as lidocaine or articaine. This is often the only part where you might feel a tiny pinch. Modern clinics now use topical numbing gels before the injection, making the needle nearly imperceptible. Once the area is numbed, the surgeon makes a small incision in the gingiva or gum tissue to expose the underlying bone. In some advanced cases involving flapless surgery, this step is even more minimally invasive, leading to even less postoperative swelling. Step 2. Creating the osteotomy, which is a precisely calibrated hole in the bone. Using specialized high-speed surgical drills cooled by a constant flow of sterile saline, the dentist prepares the site. The saline is critical because it prevents the bone from overheating, which is a major factor in successful osseointegration and pain management. If you are watching this, you might hear the sound of the drill, which can be intimidating. But remember, the nerves are blocked. You are safe. Step 3. Implant placement and torque. Once the site is prepared, the titanium or zirconia implant is threaded into place. Surgeons use a torque wrench to ensure the implant has primary stability. This means it is tight enough to begin the healing process. After the implant is secure, a healing cap is placed, and if necessary, a few small sutures are used to close the gum tissue. The entire process for a single implant often takes less than 30 minutes. We're about to move into the recovery phase and the pain timeline, exactly what you will feel on day 1, day 3, and 1 week later. But before we do, I want to invite you to join our community. If you're finding this breakdown helpful and it's calming your nerves, please hit the subscribe button and turn on notifications. We're dedicated to providing transparent dental education that saves you money and stress. Now, I want to hear from you. On a scale of 1 to 10, how afraid are you of dental pain? Leave a comment below with your number or share your personal story if you have already had an implant. Your experience could be the exact encouragement someone else needs to hear today. Also, if you have a friend who is currently missing a tooth but is too scared to see a dentist, send them this video right now. Knowledge is the best cure for fear. The real question of does it hurt usually refers to the hours after the surgery, as the local anesthesia wears off. You will start to feel the inflammatory response of your body. This is not the sharp, stabbing pain of a toothache. It is typically a dull, throbbing ache or a sensation of tightness in the gums. For 90% of patients, this discomfort is easily managed with over-the-counter pain relief, such as ibuprofen or acetaminophen. Your dentist may also prescribe a specialized antibacterial mouthwash like chlorhexidine to keep the site clean and prevent infection, which is the leading cause of post-surgical pain. The pain timeline, what to expect. Day 1 to 3. This is the peak of the inflammatory phase. You may experience minor swelling and bruising. This is normal. Using an ice pack on your cheek for 20 minutes on and 20 minutes off will significantly reduce the pressure. Day 4 to 7. Most patients find they no longer need pain medication by day 4. The gum tissue begins to knit together and any soreness should be fading rapidly. 1 week later, by the time you return for your follow-up or suture removal, you should feel completely back to normal. If you are still experiencing sharp pain at this stage, it could be a sign of an issue and you should contact your clinic immediately. Factors that influence pain levels. Not every dental implant surgery is the same. A single tooth replacement is very different from a full mouth all-on-4 reconstruction. If your procedure requires a bone graft or a sinus lift, the recovery may be slightly longer because the surgical site is larger. However, the protocol for pain management remains the same. Your overall health also plays a massive role. Smokers, for example, often experience more pain because nicotine constricts blood flow, slowing down the healing process and increasing the risk of dry socket or infection. Maintaining a soft food diet and avoiding straws for the first few days is essential to protect the blood clot and ensure a painless recovery. The long-term reward. While there is a small window of discomfort, it is important to look at the long-term benefit. A failing tooth or a missing gap causes chronic issues, shifting teeth, bone loss, and difficulty chewing. The minor, temporary soreness of an implant procedure is a small price to pay for a permanent, functional, and beautiful smile. So, does a dental implant procedure hurt? The clinical answer is no. With modern anesthesia, 3D surgical planning, and advanced post-operative care, the process is smoother than most people imagine. Don't let fear dictate your health. Research your surgeon, ask about their technology, and take the first step towards restoring your confidence. You have the facts now. The next step is yours.